The Desert Healthcare District is pleased to present to you this new grant making program. I would love to upload the presentation. Megan, would you please? So we will be walking you through a few slides that will provide a visual on how our grant making is expected to work. And about the Desert Healthcare District, we are a public entity. We were founded with a mission to achieve optimal health at all. We are codified in the state law. You can find this in the Health and Safety Code, what a healthcare district is and what a healthcare district is allowed to do. As being a public entity, we have 7 board members that are elected by the public. These are Ms. Leticia de Lara, she's our board president. Karen Borja, who's our vice president. Mark Matthews is our treasurer. The next slide. We have Carol Rogers, Yvette Perez-Gil, Arthur Shore, and Dr. Les Sendel. Those are the 7 directors or 7 board members of the Desert Healthcare District. One of the key structures that we have within the district is our grant making team. This is the program arm of the organization, the ones that are working every day to make our grants process user-friendly and that our funds are distributed to the community. And that starts with Ms. Donna Craig. She's our Chief Program Officer. And we have Alejandro Espinosa, who's a Senior Program Officer with the Desert Healthcare District, Megan Kane, and Vanessa Smith, and Erica Huxley. We also have on our team Will, and Will is helping us with everything related to communications. Now let me say a few things about the Desert Healthcare District. As I mentioned earlier, we were founded in 1948. It was a small portion of the Coachella Valley, pretty much on the west. And the division of between east and west of Coachella Valley at the time was the Cook Street. We were founded to create a healthcare infrastructure for the western side of Coachella Valley. That healthcare infrastructure was the Desert Regional Medical Center, which we built and operated until 1996, when the onset of managed care in the state of California made very difficult for independent hospitals to be run effectively. We sought to find a partner who could help run the hospital to provide critical services to our community at the same time that the hospital was connected to a larger network. Therefore, we ended up leasing the hospital to Tenet. They run and operate Desert Regional Medical Center, and the Desert Healthcare District, since that time, have become a sort of a public foundation. The funds that we receive are then distributed to the community, and they're used to fund community clinics and other community-based organizations that provide critical services to our community members. In 2018, after a few years of contemplation and conversations about the opportunities that having a healthcare district offered to the rest of Coachella Valley, our voters decided to have an initiative and put it on the ballot to expand the Desert Healthcare District to cover now the entire Coachella Valley. The voters decided on a yes on that, and since November of 2018, the district now has expanded to a much larger geographical area. This came with a number of challenges. I think one of the most important challenges was that, yes, we did expand the coverage of the district, but we did not expand the availability of funds for the entire district. So we have now a much larger area, more than double the size of the population that we serve, but the revenues remain the same. So we have to split those dollars and make it available to the entire district. That is a problem that requires a solution, and we continue to work and explore how best to resolve this challenge, because we believe that the community deserves more, deserves better, and we will continue to work in that direction. We also understood that this new and expanded district required new resources and required a more profound understanding of the needs. In this year, we expanded the funding to the entire Coachella Valley. So any organization, whether they are in North Shore or Oasis or Palm Springs, they're all equal and they deserve the same funding or availability or access to the funding that we have in the district. We embarked ourselves in creating a community health needs assessment. We are in the midst of conducting that type of work, and we anticipate that we are going to have the results of that work sometime in early 2021. And the idea with that is to have a data-driven grant program. We want to understand, analyze, collect, and digest the information that the community is offering to us to better understand the healthcare needs in our district, and utilize that data to then have conversations with the community to create a long-term health improvement plan. This is a very ambitious project. It requires lots of conversations with the community, but we're trying to ensure that there is transparency, that there is community engagement to the deepest level with our members, and that we hear the community and we create programs that are responsive to the needs of our community members. As we were working toward having that community health needs assessment, oh, surprise, surprise, we had COVID-19 outbreak. And at the beginning of this year, that has created a new and very significant challenge for our nonprofit community. The community clinics that were working toward having better access to healthcare for the underserved, all of a sudden had no resources. They had to close doors, and the district had to be responsive to that need. We also worked with a number of many other organizations that were providing services to many community members at risk, and created a grant-making responsive program for those needs. Now, we are now starting fiscal year 2020-2021. We understand that we don't have the results of the community health needs assessment, but we have an old and expired strategic plan. We needed to come up with some strategic goals, strategic areas for our funding, and make the community have access to these funds. So you will be presented today with what those areas are. There are 5 strategic areas. You will see it today, understanding that this is a gap year and that the funding is going to help all of us recover from the COVID-19 public health crisis. And we will make $4 million available to our community-based organizations to work toward that recovery as we try to fill the gap between 2020 and 2021. With that, I believe I will be passing on the presentation to Megan. Is that correct?
Yep.
Thank you very much. And we will have a moment of question and answers at the end of this presentation. Thank you, Megan.
You can go to the next slide, Alejandro. Just to highlight a couple things around what Conrado started to mention with the COVID-19. Many of us have been experiencing it from our professional lives to our home lives, and really as an organization, along with many others, we did realize how the COVID-19 public health crisis did expose a lot of inequities and disparities in our healthcare infrastructure. And as a district, the staff and with the board's guidance, we really tried to focus on how we can adapt to that situation and be responsive and help our community members. So in the end of our 2019 and 20 fiscal year, grant making, all of our dollars were repurposed and focused on how to respond to that. And as Conrado mentioned, some of the funding, you can go back. It was nearly $3 million that we did allocate to the response of COVID-19, supporting the FQHCs like Conrado mentioned, working with different organizations in the Valley to collaborate and provide financial assistance to residents. We did some direct texting assistance as well as educational resources, such as our COVID page on our website, and using our Alejandro CV-HIP main project to help to get resources quickly to residents, as well as other things such as food distribution and collaborative funding with the Regional Access Project. And during this time that we were kind of repurposing our funding, we did want to do a brief survey with our community organizations just to see how they were reacting to boots on the ground, to people who know the community residents. And go to the next slide, Alejandro. And that kind of, some of those questions helped to inform this gap year funding. We did have almost 50 participants. Many of you on this webinar did participate, so we want to thank you again for your input and taking the time to provide us with that valuable information. Just two things we really wanted to take away from this for this presentation specifically was the amount of dependency on grant revenues. We did ask our participants to highlight some of their primary and secondary revenue sources, and you can see on the left there that grants was a big part of it. So we knew that, you know, we needed to be responsive and adapt to the community organizations as they try to adapt to the needs of the community. And that was used as, you know, a component in trying to frame our gap year funding as best we could. And then we also just wanted to get a sense of the organizational income that was impacted. And again, this was asked in May, so this has probably changed drastically and has been, you know, more impacted, but it was about 20 to 60% of organizations' income was impacted, and this was back in May. So we, you know, who knows what it could be right now, but it's bigger than that. Next slide, please. And then before starting our discussion on the gap year funding focus areas, I do want to note that Alejandro will discuss the requirements that have to be met prior to the grants team addressing any specific funding questions. So please be aware of that, where we're going through some of the highlights that were approved by our board. We do have 5 focus areas, which will go in a little bit more detail into each one. The first one is the healthcare infrastructure and services, as well as behavioral health and mental health, followed by homelessness. The 4th will be the vital human services to people with chronic conditions. And then lastly, economic protection, recovery, and food security. So the first one, the healthcare infrastructure and services, the main goal would be to provide core operating support for community actions that improve health-related infrastructure. And within this, we kind of have 3 main bullets that we want to be focused on. And that's increase access for healthcare for traditionally underserved populations, look at increasing the number of mobile and portable medical units to help increase access that way, as well as increased capacity to serve participants through telehealth technology. And the funding that was allocated for this gap year funding was $1.5 million. And our second one, behavioral mental health, this has been an initiative for the district for many years, and the goal of it in this gap year was to try to explore more how funds can be, funds from the Mental Health Service Act can be leveraged, as well as aiming to improve access to behavioral health service by these following bullets. Really trying to look at maintaining the mental health urgent care facilities, making sure that their capacity is still there for the people that need it. Again, looking at the telehealth, specifically for this one, the telesite capacity, and to increase access to mental services for adults, students, children, those that anyone who may be in need, as well as looking at how we can increase the training and certificates for people for mental health first aid, and then looking to the college counselors to see how we can get more college counselors into this school. So to try to get to that ratio of 1 counselor per 1,000 to 1,500 students, and then increasing the number of peer mental health educators. And this funding allocation for this fiscal year was an additional $500,000 to the already established Behavioral Health Collective Fund. Our third one, homelessness, we're going to seek to leverage and match other funds in this area. It will strongly support the ongoing CVEG, CV Heart activities, including the cooling centers, the case management wraparound services, as well as community outreach. And again, for this funding, for this fiscal year, we're looking at an additional $500,000 to that already established homelessness initiative collective fund within the district. Our fourth one is looking at the vital human services to people with chronic conditions. The goal of this one is really to seek to support the at-risk community by strengthening organizational capacity, looking at organizations that are serving these groups, how has their demand changed and what services and resources do they need to build up? Looking at increased levels of services to meet demand post-COVID, so what does that look like? And how have organizations changed? Also looking at supporting organizations possibly going under some mergers with similar organizations to fight or to help the similar populations, and then increasing number of case managers. And the funding allocation for this pot would be the $500,000. And then our last fiscal year, or our last strategic focus area under the district is the economic protection, recovery, and food security, looking to provide support in sustaining ongoing efforts by collaborative partners. So continuing to work with organizations so we can make a bigger difference to our community by working together, promoting community collaborations and regional work around these efforts, and then increase case management at food pantries through measurable food security, self-sufficiency, and quality of diet. And this funding pot would also be allocated $500,000. And then lastly, looking at the Desert Healthcare Foundation, this pot is $600,000, and this one will be specifically looking to promote collective impact and community collaboration. With all that funding, I'm going to hand it over to Alejandro, and he's going to highlight our grant making process, how you can access the steps that you need to take for us to begin to have a conversation with you around the funding. And then he's going to walk you through our new webpage that was created to help ease the process and make it a little bit easier for our grantees.
Thank you, Conrado and Megan, providing us with that information about how we got here and kind of discussing and providing a little bit more detail on our strategic focus areas for this new fiscal year. As Conrado and Megan have mentioned, we have revamped our grant making process. Some of you who are current grantees or previous grantees will be very familiar with some of these steps. They have not changed. I think some of the things that we have added are just a few additional steps and additional information that we're requiring from potential applicants to our grant funds. Like we have been mentioning, question and answers will be held after my presentation here, and I will go into a live demo to show you our new website, as Megan mentioned. But that being said, I have a couple of slides here to share with you about the grant making process. The first one is just this graphic to just kind of give you a visual of what our process is. It starts what we call our stage 1, which is our letter of interest, which is received, and it is reviewed by our staff. And depending on what the LOI contains, staff is either going to outright decline it, or we schedule a site visit and a meeting with the applicant to kind of further discuss the LOI and possibly provide some technical assistance and guidance in the application process. Once we feel as a grant staff that some of the criteria have been met, depending on some of the feedback that we will provide the applicant, a stage 2 will be generated. So stage 2 is going to give access to the applicant to for a full grant application that is going to include additional information about the project and target population, etc. With that information, we will be providing a staff report to our program committee. Our program committee is comprised of board members and community members. They meet the second Tuesday of the month, and we present to them potential grants that are in the pipeline for them to provide guidance to the board, and also invite those applicants to participate in the program committee meeting to answer any very specific questions that possibly the grants team might not be able to answer. From that, we move over to, we generate, like we mentioned, we do the grantee presentations. Upon the completion of the program committee meeting, the program committee either approves, conditionally approves, or outright declines the application, and then sends that information over to our board. If an application is moving forward, we will write a revised staff report that will include any new changes that have been made from the LOI or to the grant application itself, or including some of the feedback that the program committee might provide the potential applicant to make some of those changes. So staff will revise all that documentation and put it in a staff report to be presented to our full board. Our full board does meet, the fourth Tuesday of the month. Currently, we're having our meetings via Zoom. And if you're interested in participating in our board meetings, that information is on our website. So our staff report is presented to the full board, and then the report back, we give the presentation to our board, and the board either reviews our recommendation, and they either decline the grant or they approve the grant. So once the grant is approved, the internal grants team will continue the communication with the applicants or the grantee at that point to work on contracts, deliverables, payment schedule, etc. And that's where we move on to the next stage, which, here we go. So one of the things that we like to make sure that all of our applicants are aware of is California Assembly Bill 2019 that prevents any, Desert Healthcare District grant staff from fielding any questions from any potential applicants that have not submitted an LOI. So to ensure, transparency, this Assembly Bill was passed to ensure that, applicants are not being any kind of given any preferential treatment by any staff or board members. So until the LOI is submitted by the applicant, Desert Healthcare District staff cannot field any specific questions about a potential grant or grant application or letter of interest. Once the LOI is submitted, Desert Healthcare District staff are able to meet, schedule a site visit if we're allowed to, and to be able to kind of have that dialogue and kind of walk through a little bit more and the application and the LOI, and provide at that point some feedback, technical assistance, or maybe even provide a new direction for the potential applicant. So just want to make sure that everybody's aware of California Assembly Bill AB 2019. Okay, so starting on the eligibility. So that is a big question. Who is eligible for our grant funds? So organizations, pretty much 501c3s, tax-exempt organizations, a governmental, tribal, or public entity, including healthcare service providers such as federally qualified health centers and local clinics. Those are the organizations that are eligible. The organizations that are not eligible are individuals, endowment campaigns, retirement of debt, annual campaigns, fundraising events, or expenses related to fundraising, programs that politicize or promote any religious or sect or deny services to potential beneficiaries based upon religious beliefs, political campaigns or other partisan political activities, including lobbying public officials. So since we are utilizing tax dollars, we could not use any of our tax dollars for any kind of political campaigns. Any unfunded government mandates, we cannot use our taxpayer dollars for that, or replacement funds to allow funding to be shifted to other programs or budget areas prior to the grant approval. Capital projects, at the moment, they're on hold until further notice, so we are not currently funding capital projects. Expansions of clinics, et cetera, those kind of projects are on hold. And organizations that discriminate against certain groups or individuals in the delivery of programs and services. So we want to ensure that our grant dollars are being utilized in an equitable format, and that all of our potential Coachella Valley residents are able to benefit from any program or service that the Desert Healthcare District is funding. So the grant requirements. So the organizations must directly serve residents of the Desert Healthcare District, which encompasses the majority of or all of the Coachella Valley now with the new expansion. And also number 2 is organizations must address one of the Desert Healthcare District 5 strategic areas. So the program or project that is being proposed must fall within one of the 5 areas that Megan covered earlier on in our presentation. And then for number 3, except for mini grant recipients, which are under $5,000, and we'll go a little bit more into detail on that, organizations might have current audited financial statements in order to apply for our grant funds. So as we mentioned earlier, the whole process starts with the letter of interest. So the letter of interest, and I'll show you where you could access this. So it's accessible via deserthealthcaredistrict.org. That's what starts the process. If you are a returning applicant or a previous grantee or recurring grantee, you're very familiar with Blackbaud, which is a grants management software that we utilize. If you currently have a username and a password, those will not change. So you will not need to apply for a new profile or username or anything like that. Unless you're a new grantee, then we will ask you to create a new username and password and profile, where all of our applications and reporting documentation will be housed for our grantees. And with the letter of interest, the applicant must submit a 501c3 determination letter, the program budget, utilizing the Desert Healthcare District form that is on the website, and then the current audited financial statements, except for the mini grant, as I mentioned earlier. And if you're pre-qualified, the district staff will contact the applicant for a proposal conference call and a possible site visit if we're allowed to. And that's where, once again, we're able to field very specific questions relating to the proposed program or project. Following that, once we have met with the organization and we feel confident in that they have addressed some of the concerns that the Desert Healthcare District grant staff might have discussed during the site visit or the conference call, we provide a link to a full grant application that it's gonna require additional information from the grantee on the proposed project or plan. So the applicant, we're going to be completing several sections within the application itself. We're going to provide, basic information on the organization itself, the program/project description, the goals and evaluation, the organizational capacity and sustainability, strategic partnerships that have been established to possibly, augment the impact of the program or project within the community. And also, how does the organization address diversity, equity, and inclusion at the board and staff levels? So once the Desert Healthcare District staff reviews all of this, we will be scoring the grant application, and we'll be showing you what those scoring criteria are and some of those sections are. Then it goes to the program committee. As I mentioned earlier in the little chart, program committee is the first step. They will ask the organization to come in and present and provide additional information if needed from to address questions or maybe clarification that might be needed for our board members and community members that sit on our program committee. And then upon the conclusion of the program committee, either the program or project will be conditionally approved and moved to our board for full approval. And once again, further discussion amongst other board members that are not part of the program committee. And then reporting requirements are outlined in the grant contract. This includes the midway progress report and final report, and we'll be discussing those in later slides here. So for the mini grant application, it's very straightforward. It starts with a letter of interest once again. The maximum allocation for mini grant application is no more than $5,000. There is no requirement for audited financials for a mini grant application. So we try to do that to increase the capacity of other organizations that might not have audited financials, but might need some assistance in promoting a project or program within the community. So we do have the mini grant application program available for those types of organizations. The mini grant application does not go through the program committee or the board approval process. The mini grants are approved by Conrado, and with the recommendation of the grant staff that would provide him with a report and our recommendation to whether approve, decline, or approve conditionally with some changes for the mini grant application. And then the reporting requirements are pretty straightforward. It's just a final report that will be submitted to the district upon the completion of the grant. And for mini grants, we only allow one request per fiscal year for our mini grant applications. So our scoring criteria is, there's 10 sections that we are scoring. It's out of 100 points. So some of the sections that we score on are the executive summary, the community need and alignment, the goals of the project, the proposed evaluation plan, the project or program, the applicant capacity and infrastructure to actually execute the proposal, ensuring that they have the adequate staffing and resources to actually implement a program or project within the community. Also, the organizational sustainability, the proposed budget, key partners in collaboration, and the compliance in the fiscal department, and also financial stability. And something that we are doing this year that we haven't done in previous years is that now our fiscal team will be scoring the fiscal forms and financial documents that are provided with the application or the LOI. Before, we would just get approval and the okay from Chris Christensen and the rest of the fiscal team, but now they're actually going to be scoring some of these, those two fiduciary compliance and financial stability sections within our scoring criteria. So with that being said, I know it's a lot of information, but now I think it'll be easier if I show you our website. So I'm going to stop sharing our PowerPoint here and move into sharing the screen of where you could actually find our website information, our grants information. All right, so now what I'm showing you is our landing page. Our website is dhcd.org. On the right-hand side, as you can see, we are gonna have a tab, and we're gonna have a tab that says grants. Okay, here under the grants, this might be something new for some of our new grantees or returning grantees. Here we have three options. We have grants programs, we have current grantees. So if you're a current grantee looking for to access your Blackbaud or your grants management software portal, you will click on that and it'll take you directly to the portal itself. So the grants programs, we'll start with the grants program. So what we have here is really basic information about the grants program. It highlights, some of the things that we discussed in the PowerPoint. The first thing here is our grants policy that was board approved. So you're able to just click on here to get the full board policy for our grants. Another thing here is a prevailing wage law. Any project that is approved by the Desert Healthcare District or program has to have or has to abide by the prevailing wage law, the California prevailing wage law, to ensure that any contractors, staff are adequately being compensated for their work. Another thing here is our California Assembly bill, like I mentioned. In order for Desert Healthcare District staff to field any questions that our applicants might have, they have to first submit an LOI. Once the LOI is submitted, then we are able to provide technical assistance and guidance to the potential applicant. And the law that precludes us from not doing that is AB 2019. And also here, we also want to ensure that equity, fairness, and transparency and accountability in grant making is important. So we want to ensure that some of the information that I was providing to you in the PowerPoint is highlighted here. So we have what are the mini grants? Okay, what is a grant? Who is eligible and who is not eligible? That information is here on our webpage. And also the requirements. So very simple and straightforward. On the left-hand side here, once you guys are ready to apply, so you have the two options. So you have the option for apply for the grant and also the option to apply for a mini grant. So once we click, let's say I want to apply for a grant, I will click on this hyperlink, which will open up now the steps, the 7 steps for to apply for a full grant, which is over $5,000. So the first step, very easy. If you're a new applicant, you will click on here, okay, to establish a new account on Blackbaud, which is our grant management software. And if you're a returning applicant, you will skip to step number 2. So step number 2, okay, provides you with different information, okay. Here is the hyperlink for the letter of interest. So you will click on that and it will take you directly to our grant management software to sign in, use your password. And if you're a new applicant, this is where you will click to create a new user account. Okay. Here is a hyperlink for if you want to get a little bit more information on what is required in the LOI, you could click here and a PDF document will will appear with the different steps and the different items that need to be included as part of the LOI. Here are the 3 items that we discussed that need to be included, the attachment that need to be included with the LOI, which is the 501c3 determination letter, the program budget using the template. And once again, if you click here on this hyperlink, you are going to be able to download the budget template for you to use, and then audit the current audited financials. So those will be the 3 items that would need to be included with the LOI. And once again, here it highlights the steps of what's going to happen. Once we receive that information, the applicants are going to undergo a legal, financial, and programmatic review to ensure eligibility and financial health of the organization. And then to pre-qualify, the district staff will contact the applicant for a proposal conference and/or site visit. And once all the pre-qualifications are met by the applicant, then we are going to give that applicant access to the full grant application, which if you want to see what those steps are or what those additional information is going to be is on the grant application. Once again, you will click here and you will get a PDF document with that very detailed information. The 4th step is the staff and program committee review. So once again, here is highlighting the 4 steps. So what happens after, the program committee says, this is a great application, let's move it forward to our board. So the grant application is going to be sent to the board for approval or make edits or resubmit with modifications or an outright decline because maybe the application did not align with our strategic areas or any other reason that the program committee or staff might decline that application. The next step after the program committee review has concluded and the application is forwarded to the board, which is number 5 here. Once again, our board of directors meets the 4th Tuesday of the month, and they will follow and they will review the program committee's recommendations, and they will vote on one of the following program committee recommendations, which is number 1, to approve the grant application as is. Number 2 is to approve the grant application with minor modifications or edits. Or number 3, the resubmit of the grant application with major modifications and or edits, or outright decline the grant application. Okay. And then all applicants are going to be notified when their application is going to come up for review at the program committee level and also at the board level to ensure that they're in attendance in case our board members and community members that comprise our program committee and our board members at the board level, if they have any questions, you know, we hope to have a representative from the organization that is applying for a grant in the audience to ensure that, you know, those specific questions that the grants team could not answer, we have somebody from the organization there to answer those very specific questions. And then the last step here is the grant approval. Once the grant is approved, Desert Healthcare District staff will work with the funded organization to finalize a couple of logistics, which is the contract itself, some of the deliverables, the payment schedules, and the reporting. Then lastly here is the grant reporting. This is where, you know, once the grant is approved, we as a grant staff will upload the progress report and final reports onto your grants management software account. And this is where you'll go log in to provide us the 6-month report and final report if it's a year grant. Okay, and also within this section, there was also another full grant budget form that would need to be downloaded and included as part of the final report that you will submit at the end of the grant period. And here on the left-hand side, we have some resources for the grantees, which is the budget instructions on how to complete the budget template that once again is here available on the left-hand side. And then also a program project cash flow form that we have created for the organizations to complete and provide to us as an attachment during the grant application process. So this is where you will find that information for the full grant. If we go back to the main page, we have the same information for the mini grant. If we click here on the mini grant, it's going to have the same steps, but once again, the mini grants are not they will not go through the same process as a full grant. So they will just be approved at the staff level, but they will start once again with the letter of interest. Okay. And now they would include a 501c3 determination letter and the program budget using our budget template. Okay. Once again, once we have met and discussed the LOI with the potential applicant, we will provide them with the link for the full grant application that would appear on the grant management software portal, and to continue and add additional information that we would require to complete the full grant application that is going to be presented to our CEO for approval. The grant staff will provide the recommendation to Conrado, and Conrado will make the decision to either approve or decline the mini grant application, which is highlighted here. And then once again, once the grant is approved, you know, we at the district will communicate with the organization to finalize, you know, some logistics. Once again, it's the contracts, the deliverables, the payment schedules, and the reporting for that mini grant. And once again, here's the grant reporting. And pretty much a single report identifying the outcomes, the number of people served, deliverables, and providing copies of all receipts is required within 30 days of the project end date. And that's just for the mini grant itself. And once again, we do have some of those forms that would be required to be submitted with our grants here on the left-hand side. So very, very easy and straightforward. We try to streamline the process as much as possible. You know, for some of the returning grantees, you know, some of this information looks very familiar. Some of the information that we have included was more to do with equity and transparency, and how is the organization addressing those those key things at the staff and board levels, and just asking a little bit more information about, some of the target populations. But the process itself remains the same. We just added additional steps to the whole process. With that being said, a couple other things here on our grants tab that I want to show you is that we have our grants program. So this is where you'll go for this particular section that I just showed you, our current grantees. You'll be able to click on here and it would go directly to our grant portal. So once your grant has been approved, you just go to this tab and you're able to log in directly to your grant portal to submit your reports or your progress reports or final reports or any other documentation that might be needed. And then lastly, on the grants tab, we will update this view recent grants. So we will have here who has been funded. We are working on that, and we are going to provide we're going to go back 10 years and provide that information. And so we are transparent to our community to see, so our community members and residents are able to see who has been funded within the last 10 years and how much and for what. So we're trying to be as transparent as possible, and we will be updating this information shortly.